Ladies and gentlemen, good morning and welcome to this sunny day in the UAE. This is our 10th and final webinar as far as ObeFit is concerned. And of course, this is an appendage to our COVID webinars, of which we have completed about 20. Now, since we are talking about obesity, and our participants comprise of 10,000 individuals who have registered for this RAC Biggest Weight Losers Challenge, we've understood over the last series of webinars that, broadly speaking, there are three ways to manage your weight. One is, if you are overweight, you could resort to diet and exercise. If you have some comorbidities, I would imagine that your physician would advise you on certain medication. But if you are grossly obese and you have comorbidities, and the quality of your life is impacted by obesity, then surgery is perhaps your best choice. And therefore, ladies and gentlemen, we have saved the best for last. And why do I say save the best for last? Because my own understanding of weight loss tells me that bariatric surgery is perhaps the most permanent of all systems of weight loss. You undergo bariatric surgery, you lose up to 80% of your excess body weight, and broadly speaking, you are able to maintain that weight loss for the next 10 or 15 years. With appropriate lifestyle change and lifestyle support. But to be eligible for bariatric surgery, you need to have a BMI of above 35 or 40. You need to have comorbidities, and perhaps you need to be more than 50 kgs or more overweight. Ladies and gentlemen, I have a pioneer with me at this webinar, and it is my great pleasure and honor to introduce Dr. Suren Ogale. Dr. Suren is a pioneer, I have mentioned that, and he was the first person in the south of India to undertake laparoscopic surgery. The first person, a pioneer, a true pioneer. He is the director of the Department of Bariatric and Metabolic Surgery in Kirloskar and Vrinchi hospitals at Hyderabad, and a visiting professor of surgery at the KLE University in Belgaum, a visiting consultant in Kolkata, Goa, and Mumbai. His team is the second in the world. And here again, you talk pioneer, second in the world to start laparoscopic ileal interposition surgery for type 2 diabetes, which is perhaps the major scourge of the modern world. He uses surgical methods to manage diabetes, a true pioneer. He has trained surgeons in Turkey, Georgia, Iran, and Mexico. He has 28 publications, 28 in metabolic and bariatric surgery, and 7 book chapters in international journals and books. He is the associate editor of the Journal of Bariatric Surgery and chairman of the Scientific Committee of Obesity Surgery in India. He is highly awarded, and we will talk about just two. He received the Great Contributor Award for his pioneering work of 30 years in laparoscopic surgery in India from the Association of Minimal Access Surgeons in India in November 21. And he was awarded the International Ambassador Award by the Society of American Gastrointestinal and Endoscopic Surgeons. Ladies and gentlemen, again, I say it is my great honor to have with us Dr. Surain, who will be talking about bariatric surgery, which as I recall, in Greek is weight treatment. Bariatric surgery is the treatment of excess weight. It comes from the Greek root. And we have Dr. Surain to take us through his presentation on bariatric surgery for our obese participants. Dr. Surain, it's all yours, sir.
Well, a very good morning to you all. And firstly, my thanks to Professor Adrian for having invited me here to participate in this webinar of yours, and Dr. Wilku for coordinating and helping me through the process. To Professor Adrian again for that very flattering introduction and all the compliments. I accept that graciously and gracefully. And with that, let's dive into the subject of the day, that is bariatric surgery for obesity. And I'm going to start my screen sharing, and we'll share all the experiences that we've had from our local Indian environment and perspective, as also from the global arena, as I've been interacting with bariatric surgeons and patients worldwide, including the patients who suffer from diabetes along with obesity also. So let me try and take you through this journey, and I would appreciate if the questions that you may have could be accumulated, and at the end of the talk, I'd be happy to answer any and all of your questions. So if you can see my slide clearly, I will proceed with the presentation.
We can see you clearly, sir.
Great, great. Thank you so much. So weight control is like a very jealous wife or mistress. If you don't pay enough attention, it goes out of control. And as Professor Adrian said, that bariatric surgery would probably be a lifelong solution for obesity that is extreme. But I'd just like to qualify that, and he did too, when he added that, yes, of course, you have to make some changes in your lifestyle and your habits and your food and your exercise and in the mindset. And this is supported by encouragement from members of the family and friends around you. So even if bariatric surgery is done, it is the best for getting a very good, I would say, control of weight, but the maintenance for the future and for lifelong, I would say that everyone should aim for one procedure, if possible, that can maintain your weight for the rest of your life, and not only hope for 10 years or 15 years. And it's not easy, as nothing that is good in life is easy. So this is to give you a perspective of how the numbers of obesity are increasing worldwide. Incidentally, in some of this data, the UAE region is not mentioned, but it gives you a very good idea of how the numbers have been going all over the world. And here you can see another chart showing you severe obesity of from 38% to in Japan and in Korea being low. Even in India, the percentage is low, but because the population is high, our numbers are very high. And from what I've learned in UAE, it is at least between 35 to 50%. And you may have the more accurate figures with you. So you can see how obesity is impacting even when people are going for donation of part of their liver to their family member for a transplant. More than 50% of the donors here have fatty liver. And then they are rejected for that reason. This is how a liver looks on a laparoscopic view. And you can see how the livers become very rough. Normally it is very smooth. Yeah, it's rough and nodular. All this yellow on the sides is all fat. And this is what happens to the liver when initially it starts accumulating fat. You get grade 1 fatty liver, grade 2, grade 3. Then you get fibrosis, and then it progresses to cirrhosis. So nothing is to be taken very lightly, because in this day and age with COVID having engulfed the world, we all realize even more that no matter how much wealth or resources you have in this world, if you don't have your health, everything goes down the drain, and in one moment, life can be over. And then what was the use of all that running and working and accumulating wealth? It's all gone. So we come back to the essence of this, that you have to do your bit. You have to be accountable to yourself. And we need to start young. We need to start education and awareness from home. Because you can see that globally, there is such a great increase in obesity in childhood. And I think this is one of the saddest things that we are seeing the world over. Because imagine a child who should have a fun-loving life, running around, enjoying his food, playing games, meeting friends, enjoying his school. If they suffer from obesity, they start having a certain amount of depression. There is a social withdrawal. There is a teasing of the child by others who are not obese. So there are a huge amount of psychological implications which will carry on into their adult life. So I think this is one of the saddest things. And I think this has to be our biggest focus, because this is going to be the future on our planet. So there are various types of bariatric operations. I'm just going to give you an overview to try and explain to you in simple language. And this lists the 4 operations which have been more or less accepted by most societies in the world. Not that these are the ones which are done the most at present, but just to give you an idea. So obesity had been declared as an epidemic, and then that was by WHO in 97. But imagine the sluggishness and the bureaucracy in our minds, in our own minds. And then the bureaucracy progresses in organizations, in society, that it took 16 years before the American Medical Association declared it as a disease. Because until it was declared a disease, it doesn't get supported by insurance. It doesn't get the importance that it should get. And even members in the family who are dealing with people who are 150 kilos, 175 or 200, they did not take these things seriously and just told their family members, you should go out and exercise and run around and walk and go to the gym, not realizing that a person with that heavy weight is unable to walk easily, their knees start paining and hurting, they cannot climb stairs easily, and they're huffing and puffing along in life. So the awareness and importance that society needs to pay to this is very, very crucial, because this has also got genetic and epigenetic origins, and it affects so many organs in the body, including, mind you, there is infertility. So when women have high obesity, they are not able to conceive. There is an increase of cancers in people who have got obesity. These are things which are not always highlighted and not always made aware of in society. So I think we need to pay attention to this. And so very rightly, I had also seen a sign at a wellness center which said, if you think wellness is expensive, try illness. Similarly, this doctor said, if you think investing in your health and fitness is expensive, then wait till you see the burden of disease and the cost of treatment, which is so true. But most times, until something happens to us or someone close to us, we don't take these things seriously. So more and more data about the world regions showing you how obesity is increasing rapidly. And along with that, there is diabetes that is increasing all over the world. And you can see some of the numbers which are listed here as Middle East and North Africa. These are figures which are in 2015, 35 million in that region. And the projection for 2040 is 72 million, which is more than twice that amount. And then there are more recent figures, which again, if I highlight the Middle East and North African region, 2019, they already beat all the projections. It was 55 million. 2030 projection 76 million, and 2045 108 million. So this is something that has to be taken really seriously. There are simple ways for you to understand when you need to really do something very seriously for this, by calculation of your body mass index. The exceptions in this are, if you are a bodybuilder, you may have an immense amount of muscular weight, in which case this BMI index will not apply to you. But otherwise, for most of us regular people in society, this is a calculation when you take the weight of the person in kilograms and you take the height in meters or in centimeters, and you apply a formula and you get what is the body mass index. And then there are guidelines and classifications to show which is serious obesity. The cutoff for these levels is lower amongst Asians, because Asians have a higher percentage of body fat and the fat inside the abdomen. The fat that is dangerous is not the one which is under your skin. The fat which is inside your abdomen, which is predominantly in the liver and along with the intestines. It surrounds the kidney, surrounds the heart. These are the areas which are more dangerous because they lead to higher risk of death, and death usually comes from heart disease, heart attacks, and from diabetes and the complications of diabetes. So diabetes going along with obesity increases the risk of so many problems in the body, mainly to do with the kidney, where you have people going onto kidney failure, dialysis, and then need a transplant. You have gangrene of some of your limbs in the legs or the toes, and you need to have amputations. You have loss of eyesight. Blindness is caused a lot by diabetes, which is uncontrolled. And of course, heart disease leading to death. There is a term you might come across quite often, which is metabolic syndrome, which includes a lot of these metabolic problems, as we call them. That is diabetes, obesity, high cholesterol, triglycerides, high blood pressure. And as Professor Adrian outlined earlier, this comes from a Greek term of baros, meaning heavy or large, or the pressure. So bariatric surgery is a method whereby you reduce the weight, you're dealing with the excess weight, and you are able to reduce the weight to a significant extent. Metabolic surgery is the other term where the focus is more on diabetes. So it could be diabetes by itself, but it also, in most parts of the world, is diabetes along with obesity. So these go hand in hand. And there are various guidelines, mainly from the US, the National Institute of Health, where they explain how if your BMI is more than 40, then you are eligible and you should seriously consider bariatric surgery if you are not able to bring down the weight yourself by natural methods. That is, your diet adjustment and control is important. What is important is reduction of high calorie items in the diet. What is important is even a certain amount of exercise. It could be 15 or 20 minutes at times. It could be half an hour. You don't have to exercise for 2 hours every day to be able to stay healthy. The third aspect, which is usually overlooked, is dealing with the mind. The mind, mind you, influences so many hormones in the body. There's anxiety, stress. Stress is there for everyone in life, but it depends how you deal with stress. So your attitude towards stress is very important. So if you are not able to be free of all these stresses and strains that we pull onto ourselves, then we bring about a lot of disease onto ourselves. So dealing with the mind, having the right attitude, freeing yourself of anxiety, whether it is through breathing exercises or meditation or spending time in nature with your family, happy times and positive times, positive thoughts and positive times. So weight loss surgery or surgery along with weight loss and for diabetes, there are these guidelines, and the eligibility on the BMI is reduced when diabetes is concerned. So even if your BMI is lower, but your diabetes is severe, you could still be eligible for surgery. And that is where the special surgeries for diabetes also come along. There are so many meetings and consensus and joint statements from all over the world which are giving guidelines, and repeatedly the emphasis has been that we need to create more and more awareness in society that we have to be accountable for our health and have to do our own bit. We cannot expect the government or the hospital or your physician to do everything for you. So you can see that in the Asian zone and Middle East would come close to that, because a lot of people in the Middle East are also of Asian origin. So again, all the multiple guidelines, and this is to show you how mortality rate in life is increased in patients with diabetes. Multiple studies all over the world. So the evidence exists everywhere. The issue is, are we going to be aware of it, number one, face it. It is like we have people who meet us for extreme obesity or severe amount of diabetes, but they go on worrying about, is it going to cause me complications? Will it cause me looseness of skin? Will it cause me hair loss? But they forget the main problem is your body is undergoing so much of damage. And look at the different areas where the damage can be. And this is how death can come about in an untimely period for any individual. Then as we go along, if we don't address the problem, the costs go on increasing of treating the disease and treating its complications. So even if you as a family unit are not able to control things early enough, you will end up spending a lot of your increased earnings. Even if you're doing very well in life, you'll spend it for disease control and complications. Similarly, the country also spends this amount. When you have a national healthcare program, and if you have a nation that provides health insurance for its citizens, then the country may be doing well economically, but then the country is spending so much of money on all these expenses. So there are various ways in which obesity surgery and the metabolic surgery works. One is it brings about a reduction in the amount of calories that you take. Then the operations we do, they influence the hormones. They improve the action of insulin. They improve the action of the beta cells in the pancreas. They reduce the toxicity, the damage which is happening because of the fat cells in the body. They stimulate hormones in the intestines, especially lower intestines, which release good hormones which are able to do this. It also improves the bacteria of the intestine. And there is a great amount of interaction between the bacteria in the intestine, the bile acids in the intestine, and the intestinal hormones. And in simple ways, these lead to a reduction in the appetite. They would lead to a reduction in the weight because there is a lot of burning of all the excess fat is taken off. And there is an improvement in the action of all the hormones. So with a little bit of hormone which is secreted from your different organs, your body will function better and better. Over the years, we have seen there are so many intestinal hormones which many years ago were not known. And they have so many important roles to play. So this is just a indicator. I don't want to go into details which may not interest you, but just to show you how different parts of the intestine, when stimulated by food, will secrete different hormones, and how they help in control of your weight, of your excessive craving of food, of getting you to like the healthier foods automatically because of certain hormones secreted from the brain, and how they can burn more and more fat in the body and bring your sugars under control, bring your blood pressure under control, and all the other various factors which have become abnormal, which is why this is called metabolic surgery. Multiple types of surgeries where you just have operations on the stomach, or you have operations on the stomach and the small intestine. These are the two main groups of surgeries. So this is how historically, so many years ago, bariatric surgery has started. So it is about 70 years old already. In those days, it was done as open surgery. It is in the late 80s that laparoscopic surgery has come in. So it is even more comfortable now for a person who wishes to undergo this, because it is keyhole surgery, small incisions, minimal pain or many times no pain, rapid activity, because you can walk the same day of surgery and you could go home either in 2 days or 3 days time. And the latest with this, of course, is there are some endoscopic procedures also which help to a smaller extent, but there is robotic surgery to help us make it even easier, even in very, very heavy individuals. So worldwide data shows you which are the types of operations which are more commonly done. So the operation only on the stomach, called the sleeve gastrectomy, is done more commonly all over the world. And in the UAE also, it is done in the highest numbers. In fact, I would say that from anywhere in the world, the highest numbers of sleeve gastrectomy are done in UAE. Then you have the group called the bypass group. And at times, just the sleeve is not enough to take care of the excessive amount of weight, because the excess weight is too much in excess, or when the diabetes is significant or severe, then you need some sort of a bypass surgery to help control those parts. Previously, banding of the stomach was popular, but it's gone down all over the world. A very effective surgery is called the duodenal switch that has a large amount of bypass. So initially there was only operation on the stomach, then there's stomach and intestines with small bypass. That is, you're bypassing some part of the intestine. Then when the bypass became more, it led to some problems with nutrition and malabsorption. And that is why the operations with high bypass are done very little in the world. In some parts, especially in Canada, North America, little bit in Europe, where the intake of proteins is very, very high and they're able to withstand it to a certain extent. These are again just names of what is done more commonly these days. As I said, sleeve, this type of bypass, it's called the Roux-en-Y gastric bypass. Then there have been modifications of that to make it easier for the surgeon and less complicated for the patient also, called the mini gastric bypass or one anastomosis gastric bypass. And you have the other side where you have the more uncommon procedures. So there's bariatric surgery focusing on morbid obesity, and there is metabolic surgery which could be done even on a lean person with diabetes, because this focuses on diabetes. This is one of the earlier types where they put a band around the upper part of the stomach. and it had a connection with a port where this was under the skin, and you could inject saline into it, inflate the band, and control the amount of food that was going into the rest of the stomach and the intestines. Initially, very simple to do, very popular. As the years went by, there were more and more complications of the band because this would sometimes slip up and down, or with the pressure of the band, it would go inside the stomach, would ulcerate inside, and more bands have been removed over the years. So at the current time, very few centers doing the band. This can be done effectively if the person, like the way I offer it to my patients, if a person is willing to do their bit in the first 2 years, do your diet control, exercise, help the band, and reduce your weight, then I remove the saline from the band so that there is no pressure. This avoids the complications, and anytime in future, the band can be inflated if there is some weight gain, but there is no constant pressure, and that's how we can reduce the complications. So that is how I use it, with this understanding with the patient. And this is to show you in more detail how this is connected. This lies under the skin where the saline can be injected here with a needle. And here there is no cutting of the stomach. So in the earlier phase, many people preferred it. Many parents preferred it for their children who were very young, because there have been children with obesity, high obesity, even at the age of 6 and 8 and 12, who had to be operated because they were extremely obese, and there actually were deaths in children that young. Then chronologically came the bypass surgery, as I mentioned to you, which earlier was done as open surgery. Now it's all laparoscopic surgery or robotic if one wishes to do that. So in this, the usable stomach, because the stomach is divided into two, what is used is this small area of the stomach, and the intestine is brought up and attached there to create a bypass of this route. Then when some people after some years began to gain weight of the bypass, they also introduced placement of a band on the bypass. So various ways tried, because nothing is permanent in this world. Even if you've lost good weight, you have to keep on maintaining that. And these are some of the technical issues and outlines which are shown. How the small stomach, intestine joined, and the bile goes from here, which I will show you shortly. So basically, this does give you a reasonable control of diabetes. These were the earlier figures. Now, in many randomized clinical trials, this figure has come down. So it's not considered the best right now. So the numbers of this bypass surgery going down in the world, and other bypass procedures are increasing. Here's just to show you, I thought it might interest you to see an animation of how these are small incisions made on the abdomen. There could be 4 or 5 or 6. These are trocar cannulae inserted, and then through that, our instruments go inside, and we see everything with a video camera on a screen with a magnified view. And then you can see inside where there's the food pipe, there's the stomach. And here, with the use of a stapler, the stomach is divided into two, and the small part is used for food. This part remains in the body, but it's not used for food. And the intestine is divided here, and this portion is taken up and joined to the small stomach so that the food goes down that way, and the other part of the intestine is joined to the other part. Now you can see this is the bile secretion. The pancreas and the bile secretion goes from here, food goes this way, and they all join and they mix lower down, and And that is how the real digestion takes place lower down in the intestine. So because of this much amount of bypass, there is less absorption of calories, there is stimulation of some intestine hormones, and that is how it makes the body burn fat and lose fat. Then came the simpler operation of just operation on the stomach called sleeve gastrectomy, which I mentioned is the most common procedure done in the UAE. Here you can see there's no operation on the intestines. The stomach is divided by a stapler into two. This portion, which has a hormone here called ghrelin, this is a hunger hormone that's secreted from here. It doesn't allow you to lose weight easily. If you lose weight with a lot of diet and exercise, sometimes once you stop that, it pulls back the weight. It gives you a great deal of hunger and cravings for food. And so that's why when this part of the stomach is removed from the body, the ghrelin is reduced and the body starts losing weight. So this is the most natural or physiological for the body because you're not altering the root of the food. It's the same original root. And this, especially for younger people, is the best that can be done. But even when required, you can do a bypass for younger people or for ladies, making sure that follow-ups are good every 3 or 6 monthly to make sure there is no problem with the vitamins, which can be supplemented if necessary. So this is to show you again how the size of the stomach is reduced. So your intake becomes less, your caloric absorption becomes less, and the ghrelin hormone is reduced. And this is now to show you a quick animation.
Incisions are created on the abdomen.
Oh, this is
Trocars, which serve as passageways for the surgical instruments, are placed into the incisions. Surgical instruments are passed through the trocars to access the abdominal cavity.
Can you hear
The
the
surgeon
voice,
examines the abdomen using a laparoscope or video camera. The average human stomach can expand to hold around 1 to 1.5 liters of food. While in the stomach, food is combined with digestive enzymes to help break down the food into a more simple form, so that it can be more easily digested and absorbed once in the small bowel. During a sleeve gastrectomy, a thin vertical sleeve is created by using a stapling device. This sleeve will typically hold between 50 to 150 milliliters, or is about the size of a banana. The excised portion of the stomach is removed. The newly created gastric sleeve is able to hold approximately 1/10 of what the stomach was able to hold before. This smaller stomach sleeve restricts the amount of food you can eat before feeling full. The bile and pancreatic fluids from the liver and pancreas mix with the food and allow it to be completely digested and absorbed in the bowel. There is no rerouting of the small bowel or post-operative adjustments necessary for the.
So when the sleeve, now the problem with the sleeve is it requires a good amount of maintenance. So younger people are able to do better with this because they can exercise more. They hopefully can control their diet, which is not always easy with the young people because they crave for all the fast foods and the wrong foods at times or high caloric intake. So then again, when there were weight regains with the sleeve, all over the world it was found after some years there was weight regain. So surgeons began to put a band on the sleeve to try and keep the control on the intake for a longer time. This works to a certain extent and it's better than doing just a sleeve for those who are likely to be more indisciplined. Then you have the, as I mentioned to you, the procedure with a greater amount of bypass. This operation is very effective for weight control and for diabetes. And it has shown that they control it even for 20 years at a stretch very, very easily. But because there is a lot of malabsorption, many of these patients will have side effects of lower vitamins and minerals, and lower protein, and then problems with the liver, etc. So this operation is done in very few centers in the world for very few number of patients. Again, to show you a quick animation on that, here again you see the incisions, you see the trocar and cannulae, the instruments that are inserted, and then once you're inside the abdomen, this procedure involves doing a sleeve first. So what you saw in the early animation, a similar sleeve is done. And then there is a bypass of the intestine which is done, because here now there is a separation of the duodenum with stomach, and you have a rerouting of the food where the food gets very little amount of intestine for mixing with the bile and the pancreas juice. So digestion is much less, and therefore they lose a very good amount of weight. That is, when you need patients who need to lose 100 kilos, 150 kilos, 200 kilos of weight, then this could be useful, provided the follow-up and surveillance is very strong because of its side effects. So you can see the food is going for a long distance without any bile. Bile goes for a long distance and mixes only at the end of the small intestine. And that is why this operation is not done so much. Then multiple other modifications, because as surgeons were searching for better and better weight loss procedures, because obesity is like a chronic ailment. As I had mentioned to you, if you don't pay attention to your weight control, no matter what operation you do, if you are not living life in moderation, if you are not helping the operation, you can bring back some or a lot of that weight. So this is just to show you different modifications. And then this is another operation which has become very popular in the world now, called the mini gastric bypass, or the one anastomosic gastric bypass. So it was a modification of the earlier bypass, but there was only one connection with the intestine instead of two connections earlier. So many surgeons have started doing this when they want to do a bypass. And that, again, I don't want to go into the details. This was just to give you the information. Then again, that operation with a lot of bypass had another modification. And that is what the operation is called SADI-S. But again, the amount of bypass was reduced, but it's still quite a bit. So some patients can handle this, but this is done in more number of patients than the original severe bypass. You can see this much amount of intestine is there for the bile and the food now. And then yet other modifications of the intestine, one which started in Brazil over here and then got modified further. Then I come to a procedure that we were the team where we were the second in the world to do this, this is called a sleeve plus procedure. That is, you have a sleeve like you've seen previously, and you have a transplant of part of the small intestine, and therefore it is called ileal interposition with the sleeve. In this, you can see this segment of the intestine is transplanted here. So here it is in this diagram. There is no bypass of the intestines. So if the intention of the bypass was to get activation of intestine hormones, this operation does all that without having any bypass. And therefore we say this is the best operation in the world for weight loss, as strong as a bypass, but without any malabsorption or bypass. And many studies have shown the biggest advantage is there is no malabsorption. This is a publication from an Italian center in Milan. And that is why this has been termed by some people as the Ferrari of all procedures. Is the Ferrari the best of all the bariatric procedures? It is a bigger procedure, but the best for the patient. And I could not put an animation into this video, so I'm going to just show you an animation on the side, just to give you an idea. And please let me know if you can see this animation.
Not now, no.
Can you see this?
No.
Oh, sorry. This has to be screen shared, is it? 1 second.
Yeah, yeah. You have to share this link.
Okay, so do I have to get out of the previous screen sharing for this?
I think so. Reshare? Now we can see the presentation, the next presentation.
Yes, I clicked the wrong thing. Okay, I think. No, why am I not able to go there? I wonder. Um,
Are you able to share the slide?
okay, maybe I should just open it on my. Uh, uh,
I think you can play on your system and then you can share it.
yeah, I was trying to do that and I'm not able to. Okay, let me try this. I think this should work. I apologize for this, but I think, can you see this screen now?
Yeah, 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 yeah. This file we can see. I think this will work.
Yes, can you see it?
We can see, but it has not started playing.
Okay,
You can
it's
see the
playing
file.
on my screen.
No,
You
no,
can't see
we
it play?
just see. No, we don't see it's playing. We can see only the file. The window it has open, but it's not playing.
Oh, okay. I think let's not lose time on that. I will
Yeah,
stop sharing this then and I go back to my original presentation.
I think it will be good.
So let me know once I'm back with my presentation.
Sure. Yes, Doc, we can now see your presentation.
Okay. So I am sorry that didn't play out as I wanted to. That was a more interesting.
Mm-hmm. So you can put it on the slideshow there.
Video, but again, an animation. But anyway, I need to now click again on the slideshow, isn't it?
Yeah. Still the presentation, sir.
Yeah. Can you see the presentation? My screen is, yeah. Can you see this
Yeah.
now?
Yeah, perfect, sir.
Okay, great. So I'm sorry again for that, but going back to the presentation, when we talk of any procedure for weight loss, we talk of restriction. We are trying to restrict the calories. When we do anything with joining of the intestine to the stomach and there is a mechanical restriction, usually in the long term, it starts to fail and there is regain of weight. It is like in nature or even with a child, you restrict them, they listen to you for some time. But nature adapts and overcomes that. So we realize as surgeons that there has to be something which is stimulation of the hormones, which is why we call it's not a mechanical but a functional restriction. And this is one of our publications which shows you that the restriction created by the hormones, which controls your intake of food and the burning of the fat, is more powerful than restricting the food itself mechanically. So that is how finally, with all these various procedures, we realize that it is time to have precision medicine or personalized medicine. Therefore, it doesn't mean that everybody with the same weight should have the same operation. It means we go into a detailed medical history. We look at the mind, we look at personality, we look at scientific aspects, diseases, hormones, the results of the tests, and then we choose a procedure which is more personalized to a person. So when we looked at evidence, is medical treatment as effective as bariatric surgery? It was seen very obviously that bariatric surgery is far, far more effective. So the middle of the road path is use surgery along with some medicines if necessary and get the best you can in the result. So you need the right sort of people, yes, but you need the appropriate procedure for every individual. That is why we say it has to be personalized. So most of the operations are done completely laparoscopic. Some can be, some are done robotic. Earlier days, there used to be a combination of laparoscopic and open, and much earlier, these operations were completely open. So you can see that this was the open surgeries, then this laparoscopic, and sometimes we can do these laparoscopic by just a single incision, which is not even seen. So it's like a scarless surgery. The risks of obesity, mainly they show you how, as your BMI increases, the number of years of your life that would be lost. So leading to poor health and disease and reduction in your lifespan. And there is data all over the world. Even this data from Canada shows how there is a reduction in your life expectancy by 8 years. It has effects on the heart system, leading to multiple problems on the heart, and various risk factors, especially when there is high obesity, there is what we call sleep apnea, or there is heavy snoring at night. And classically, many of these people, they die in the early hours of the morning between 3 a.m. and 5 a.m. They get a heart attack and they die. So we have to realize that these risks of heart attacks are real risks, and we have had people who wanted to delay surgery for some months and some years, and they've actually died in the process. So there's this very important editorial from the Lancet which said, bariatric surgery, why are you using it only as a last resort? Why don't you use it early enough if you find that the person is not able to control weight on their own? There are complications that can happen with any procedure. But you will see that with the refinement of technique, equipment, and experience, the mortality rate is so low, which is much, much lower than having obesity itself. There are various issues, as I mentioned to you earlier. You can have problems of loose skin and lose little hair, but there are superficial issues which can be sorted out by plastic surgery, cosmetic surgery. And you can see, as compared with many other operations of the large intestine or esophagus or pancreas or heart surgery, bypass surgery of the heart, bariatric surgery has got the lowest mortality rate. So it is very safe in good centers and good hands. And that is an important message for you. So if one is worried about all these effects of loosening of skin, there are some things available in the market which can tone down and firm up the skin. They tone up the muscles, which also you can do it with weight resistance. And there are some equipments available. I mean, there is technology available for all these things. This is an endoscopic procedure, just to give an idea that without surgery, but this gives much lesser weight loss, only 8 to 10% on an average, and sometimes 15%. So this is to see how with the endoscope, you can take a balloon into the food pipe and that goes into the stomach. You take the balloon there, so you are occupying space in the stomach. It's as if you already have food over there. And therefore, the person eats little less and the hormone is controlled to some extent. You fill up the balloon with this saline, which is colored blue because of a dye called methylene blue. And then the tube is disconnected and the balloon stays in the stomach. Balloons can stay in the stomach for a maximum of 1 year. There are some which last 3 months, some 6 months, but the maximum is 1 year. Then there are some other things called the endobarrier. This is just to give you information of what exists in the world. This is like a sleeve that is placed in the beginning of the small intestine to prevent contact of food with the intestine. Then another endoscopic method where you put stitches in the stomach instead of reducing the size of the stomach with a sleeve gastrectomy by laparoscopy and staplers. You go inside with the endoscope and you put stitches and reduce the size of the stomach. Now this is just to show you some images of how some of the patients, how they appear, what has happened to them, how some people had so many severe problems of diabetes and obesity, and how good they have become after surgery. This is example of a younger person with type 2 diabetes whose life was living with an insulin pump. And after we operated him, this is his before and after, and for 10 years, he's without diabetes, without insulin, eating whatever normal food and living a good life. Different other individuals, a young lady who was having problems with the retina, with the eye, and getting partial blindness. She needed an injection every month in one eye. After surgery, the eye has stabilized, the eye has recovered, her vision is good, and she is a psychologist at this time in life. To tell you how good these operations can get, this gentleman lives in Dallas, 9 years after his year, in which time he has run 11 marathons. This is how good it can be with normal life after this. So the take-home message is that the intestinal tract is an important endocrine organ which can help to treat obesity and diabetes, and giving personalized treatment, we can really do the best for you. So thank you for this opportunity, Professor Adrian and Dr. Wilku. And if you have any questions that we can take quickly, I'd be happy to do that. Thank you.
I just have to say thank you, Dr. Suren, before Dr. Wilku takes on the questions and answer series. Your before and after, the pictures that you showed about the before and after was absolute proof of the great success, of the great promise that bariatric surgery holds for the thousands and thousands of patients that we have here in Ras Al Khaimah or in the UAE, and I'm sure they will all benefit greatly. I want to thank you for your free relay of information, the methodology used, the progression of bariatric surgery, your wisdom, your experience, your expertise. It all came out with such simplicity that the layperson could understand everything you were saying. I absolutely appreciate your ability to accept the combination of methods, the lifestyle support, the medical support. You showed us the gastric balloon systems. You informed us of the great benefits of surgery. They are life-saving. And I agree with the Lancet publication that why should it be a last thought? It should come early on so that you can live a better quality of life for longer periods. Doc Suren, thank you so much. I have some pride in being your friend. Thank you so much. Thank you so much for coming on. And I will now request Dr. Wilku to take up a few questions. Dr. Wilku, please go ahead, sir.
Thank you, sir. First of all, thank you, Dr. Surendra. It was wonderful presentation, and all the informations were given very precisely. We fortunately received a lot of questions which we have already answered, so there is no point raising it again. But there are 2-3 questions which I would like to take it. Harshad Singh is asking, because this is a very common thought for people: is bariatric surgery safe for health? Why he is asking, I can understand. He is having a second question also. Just a sec. Yeah.
About his mother.
Mother. Mother is grossly obese. BMI is 45 and has ulcerative colitis. Is it suggestive for a bariatric surgery? It's safe for her.
Okay. So firstly, bariatric surgery, as I showed you in data, is very safe. And believe me, in good hands, good units, good equipment, we do not see any complications, honestly. See the technical complications in operation. What can happen with these surgeries? One is you can have bleeding or you can have leakage. These are the two main problems in surgery. Good experience, good units, good equipment. We do not see this happening at all. And any good unit, good surgical unit will take the precautions to make sure the surgery is done very smoothly, very nicely. What can happen after surgery? The important thing for the patient is be in touch with the nutritionist and the multidisciplinary team, that bariatric surgical team, because the team has got a dietitian, it has got a psychologist and psychiatrist, it has got other coordinators, it has got good physicians. If you are in touch with them and 6 monthly you do a few blood tests, and then in case some vitamins are going down, you can get a supplement, then believe me, you will not have any complication or problem from bariatric surgery. So doing the surgery is far, far safer and superior than living with obesity and any of its ailments. To answer the question about ulcerative, the colitis along with the BMI of 45, we know that colitis is linked a great deal with personality. You will find practically everybody who has got Crohn's disease, ulcerative colitis, irritable bowel syndrome has got some factors in their personality where they need help. So any psychologist or psychiatrist can help them with that, reduce their anxiety, reduce their stress, reduce their emotional sensitivity, and then they start improving that. There is a lot that can be done through breathing techniques of pranayam, meditation, wellness aspects can, and food. We have, for example, a person in Hyderabad who does food as medicine. He's amazing how he has learned how different types of foods can help with these types of illnesses. So the colitis part can be taken care of by these methods and treatment. And for a weight, she can have a simple procedure like a sleeve gastrectomy, which will reduce her weight. Colitis gets looked after. So overall, she becomes very much healthier than what she is now.
Yeah, thank you, Doc. There is one question by Omar. I can understand. You have already mentioned 2 points, like Professor emphasized in the last. Like Lancet says, why it is the last resort. Okay. It may be the reason because it's an expensive. Like Umar is also saying, it's very expensive. I can't afford it. And he was unable to lose much of his weight by diet and exercise. And third, the acceptance by the insurance. Insurance is not accepting this, and they are not approving bariatric surgery into that. So that may be the reason. The second question, Professor, you may think of. Omar is requesting my last question. Can you please do this surgery as a token of reward participating in this challenge? Professor, you can answer this.
What was the question, Dr. W?
Omar is asking because he mentioned it's very expensive. I can't afford it, and he has not lost much with the help of nutrition and exercise. And he is saying, can you do this surgery as a token of reward as he was participating in this challenge?
Well, I'm quite sure Dr. Sarain can, and it'll be our job to bring Dr. Sarain across here to do that. And of course, we will have to take care of some of the costs. You please tell that young boy that we will certainly consider his request and get back to him within a couple of weeks. Okay? We will certainly consider his request.
So Omar, you have to send email on support at Rack Weight Loss Challenge. Then we can take it forward. Yes, sir. You were saying something.
Yeah, so my answer to him, and also to provide information about the Indian situation. Earlier years in India, insurance would not grant the claims very easily. We had to struggle a lot with them, and they had some exclusion clauses. But since the last 3 years, insurance, fortunately, in India has cleared bariatric surgery. If you are qualifying with BMI more than 40, etc., insurance will pay for bariatric surgery in India. So that's one real nice thing which has happened. The second thing, I'll tell you what I personally have been doing to help people, just like Omar is requesting. Because first, once we examine the person and we see that this person really needs surgery, whether it is obesity surgery or diabetes surgery, then if they cannot afford, we find a way to do it, just like Professor Adrian has suggested. Some of the methods we use are, one is we have some philanthropic ex-patients of ours or some donors who donate a certain amount of funds for the surgery and the patient gives a certain part. That's one way. Second is when we do educational workshops to train other surgeons. We are operating, but we show them how these surgeries are done. And this is like a training program in which time the surgeries are done again at a very low cost, sometimes free, but definitely at a lower cost. And that's another way we help our patients. So this was just to share the information. And yes, in special circumstances, we definitely go out of our way to help people because, as I said, if somebody really needs it, we find a way to do it somehow for them. Whether they pay
Yeah, thank you. It was nice information.
or insurance pays or the donor pays or the healthcare system like RAK hospital pays something.
Yeah, thank you, sir. There is one more question. How does bariatric surgery actually help obesity? And I have one more question in the WhatsApp I just received. Let me read it, please. You can, because I think you can club those answers. I heard about few bariatric surgery. After a few years of bariatric surgery, there is again a chance of weight gain. Already you have explained it, but can you re-explain this again, please?
Yes. So firstly, how does bariatric surgery help in obesity? Now, in bariatric surgery, as I said, by doing operations on the stomach or stomach and small intestine, we are readjusting and regulating the hormones in the body. It is not a matter of reduced food intake because if it was a matter of that, you can do it yourself, reduce food intake, but does it help? So it is the adjustment of these hormones which then start to burn out the excess fat which is in the liver, inside the abdomen, and outside also. It starts to burn all this fat for energy. And that is how bariatric surgery is able to control the weight and whatever else is the problem with that, like blood sugars or blood pressure or cholesterol, triglycerides, or fertility problems, ovarian cysts in young ladies, which cause polycystic ovarian disease, or high uric acid and joint problems in people, or the snoring and sleep apnea problems. So it takes care of all these issues. The other aspect about weight regain, as I mentioned earlier, weight control needs constant attention, just like your wife needs constant attention to keep them happy and keep them in, in good mood and good control. So even after doing surgeries, if one is not able to support it fully, some people will definitely have weight regains, especially if they become indisciplined. For example, one way is you drink high calorie liquid and it goes down easily in the system, and you will very rapidly regain weight. So I tell people you can enjoy life. You can eat everything in life, but if it's a high calorie item, eat a small amount. Be responsible to yourself. So enjoy life, do everything, do it in limits, and you will prevent any weight regains after bariatric surgery.
Yeah. Thank you, Doc. Whatever questions I'm receiving in email and WhatsApp, it's already being answered. So I don't think so there will be any more questions from my side. Professor, over to you. Sir, you are unmute. You have to unmute yourself, sir.
Sorry. Yes, all I want to do is repeat my absolute thanks to Doc Suren for that absolutely, I'm searching for a word for that, informative, etc. Small words, for that life-changing talk. Really, that is the word I was searching for that life-changing talk, for giving us all a new perspective on the surgical application in weight loss. And here we are dealing with a bunch of 10,000 individuals with several thousand above 150 kgs. And we are grateful for the advice that Dr. Suren has given us, and we will certainly work towards those ends. So the RAC Weight Loss Challenge will not only be a challenge of 3 months, but the rest of the year, we will work towards solutions. And we certainly have Dr. Suren to thank for making us see that we have a larger objective than just a challenge. And with that, ladies and gentlemen, I would like to thank Dr. Suren once more. I would like to thank Dr. Wilku for putting this all together. I would like to thank the 100 participants that have sat in and listened to this talk. I would like to thank in advance the hundreds of participants who will listen to these lectures as they remain on our website. And as you can see on our screen, that this is the last and final lecture in our series. Our challenge ends on the 4th of March with the awards. But prior to that, this announcement indicates that the final weighing in is in the physical category is in the RAC hospital on the 1st and 2nd March from 9 a.m. onwards. We expect a few thousand individuals to come in and weigh themselves. For those of us who are from the other Emirates, and that would include Dubai and Abu Dhabi and all the other Fujairah and all the other Emirates, Sharjah and so on and so forth, well, you can go ahead and take your final weight in the clinic closest to you, and register your weight prior to the 2nd March, and that is the virtual category. So we have the physical category, the virtual category. We also have the corporates that are participating in a team. A team could comprise of anything between 10 to 100 participants. And do remember, friends, when you come in for the weighing in or when you come in for the award ceremony, we would love to see that Al Hussein green pass or a 24-hour RT-PCR negative. Okay, now thank you so much, Dr. Suren. God bless you. Thank you so much for that. Dr. Wilku, thanks for putting this all together. And my team over here, thank you for spending a bit of your holiday on this. And this is our last webinar in this series, but we will have more webinars as we come along. And ladies and gentlemen, don't forget the awards on the 4th, which is World Obesity Day. I'll see you there. Thank you so much. Dr. Suren, once more, thank you, sir.
Thank you so much, sir. Thank you so much.
Thank you so much.